TV. Enriching lives. Regulated by the Uganda Communications Commission.
Great. Good morning, Uganda, and everyone who is watching the Coffee Break Conversation. My name is Ritah Nandera, and today's topical discussion, we're looking at the health sector, most especially when it comes to the issue, or can I call it a song in a country, Uganda, that is malaria, a disease that remains one of the Uganda's leading public health concern or challenges affecting families, productivity, and more so our children and mothers. And looking at this, despite the ongoing preventions, the treatment efforts, malaria continues to claim lives that could be saved through awareness and timely care. And to help us better understand the current malaria situation in Uganda today is prevention and the treatment. We are so delighted to be joined by Dr. Brian Ssemakula from Mengo Hospital, who is going to give us more of the details concerning malaria and what's the way forward as Ugandans. Are we safe or we are not safe? Good morning and Happy New Year. Thank you for joining us.
Good morning. Thank you for hosting me here. Like you've introduced me, my name is Dr. Brian Ssemakula from Mengo Hospital. I'm delighted to be here talking about this topic, malaria, today. Malaria has been with us a very long time ago. And right now, the country has tried to fight malaria. We are still talking about fighting malaria. However, we want to ask ourselves again, what is malaria?
What is it all about?
So malaria is a disease. It's a preventable disease. Okay. It's a communicable disease that is caused by Plasmodium parasites. These are parasites that, when they go into your body, when you get them into your body, they are going to cause you to break down your red cells, and they're going to cause you what we call malaria. So these parasites are transmitted by vectors, which vectors are mosquitoes. And the famous mosquito that is causing that is the female Anopheles mosquito. That is causing us when it bites you, it transmits these parasites to you, and you're going to get malaria as the result. Yes.
Great. That's a very great information. I think we need to dig deeper into this. Malaria that we are talking about has been most of the alarming concern in the country, Uganda. As Dr. Ryan, I don't know if you're so much involved into these. First, give us a background about this. Where does it come from? And I think you mentioned about behind the cameras that there are some countries, there are some districts without this malaria disease. How comes and how is that possible?
So malaria, we say it's transmitted by parasites, and these parasites are carried by vectors, the female Anopheles mosquitoes. However, there are regions like the Chigezi region in Uganda, which are not endemic for malaria, except other parts of Uganda, like central region, eastern region, the northern region, areas of Lango. Malaria is very predominant. However, in these regions like Chigezi region, it's a very cold region. It's actually called the Switzerland of Africa. So with that coldness and the way that it is still more studied, however, there having malaria is rare.
It's very rare.
People moving from there to these regions actually have to be on prophylaxis. Just like you're flying out from country to endemic, coming to the tropics, you're supposed to guard yourself against getting malaria. So the coldness there is attributed to the low malaria incidence in that region. And in case you have malaria in that place, ask you, where have you come from? So you're coming from a place which has malaria and you go to that place. So it has even affected distribution of drugs, and even it has to guide the policymakers on such areas. However, we know there's global warming taking place. So we expect that in the near future, as the whole region gets hot, the whole country gets hot, we may see more cases of malaria there too.
Looking at that, the same angle, looking at now the different parts of the districts, most especially central, we have seen so much rain. I think one of the means you can find out that after you training for some good time, you will find out the young children, the mothers, adults having this kind of the disease. Why is it that so?
So malaria, we know that the vectors which spread malaria are mosquitoes, and these mosquitoes, they have breeding places where they are going to reproduce, and this is stagnant water usually.
Yes.
So whenever it rains, you're going to get pools of water. We also know that our country, there are many things that are not done well. So you're going to get pools of water here, there, sometimes even beside the roads. Water is stagnant. So in those places, we are going to have mosquitoes breed. They are going to give birth more, and you're going to get more female anopheles mosquitoes, which are going to carry, which are going to, in case they get this parasite, they are going to carry it. They are going to have many mosquitoes with the parasite. So we are going to have many people getting infected with this parasite. And also worth noting that in our regions, the prevention mechanisms have always been misused by the public. We tell the public, please keep a mosquito net. People prefer to take them in the gardens. Some of them, here some schools don't allow mosquito nets in their schools. So it is, the public sometimes is antagonistic to the prevention in our regions. However, because of the weather changes, when it rains, all our seasons where we have maize, we get shrubs, we get stagnant water. So with all that environment, favors the birth of these mosquitoes, which are going to spread malaria. So that accounts for that seasonal changes. Rainy season, there are many breeding places. In the dry season, there will be shrubs where these mosquitoes still give birth, and then we have continual malaria throughout the year.
Looking at the mothers and the children being mostly the victims of these, why is it that so? And
so children, they are not young adults. For children, they are growing, they are developing their immune system. And they are so naive to this infection. They are not. So with this kind, when they get malaria, they have not been exposed before. So they get severe forms of malaria. So they are going to get complicated malaria, and it's the cause of death. When you have complicated malaria, it's going to affect your brain, your kidneys, your lungs. So it's affecting many organs and many systems. So that accounts for death. For pregnancy, when a mother is carrying a child is another person. So it's like a foreign body in a woman's body. So God was so smart that he makes the immunity, which would have kicked out this baby or killed this baby, a little lowered. When that lowers, the mother's immunity lowers, there's a susceptibility to getting diseases. That's why we have to take care of our mothers very well. So when they get malaria in pregnancy, it's a threat to them because their immunity is also lowered. So it's a threat to the children because malaria parasites have a preference for the placenta, which nourishes the child. So when the mother has malaria, they go to the placenta. They are going to cause stop blood from flowing to the fetus. Those are going to cause the mother gets severe symptoms. So it can cause both maternal and child death. So that's why malaria in pregnancy is a very important factor to prevent, to treat. And timely treatment is very important to prevent abortions, miscarriages, death, which is a major cause of mortality. Thank you so much.
Looking at the increase in number of cases when it comes to the malaria as Mengo Hospital, tell us the statistics of where we are. And is there any hope for the Ugandans who are out there? And why is it now important for an individual who is watching us to take so much caution about this malaria thing?
So, according to the most recent Uganda Ministry of Health studies, about 16 million deaths in Uganda. And it's coming second to the accidents.
Can't imagine.
So people are dying because of preventable issues, accidents, malaria. So malaria was surpassing it. Malaria surpasses accidents in many years. It causes death more than any other thing in Uganda. And as Mengo Hospital, we are prioritizing prevention. Prevention is better than cure for malaria. And this is it's mostly through knowledge. People know that malaria kills. Some people just say, no, musuja.
Just like that.
Then they feel the symptoms, Suja, they go to the pharmacy nearby. There are very many in this region, central region. Even other places, they prescribe themselves treatment. They get, I'm feeling weak. They get paracetamol. I'm feeling weak. I think in Suja, they get Lonart, they get animal drugs without prescription. And this is accounting for severe forms. By the time they come to hospital, they are very sick. Their organs have begun failing. They require a high specialized care, ICU, all that, which, because of even our financial burdens, you find that people who would have treated for 2-3 days, they are spending months in hospital. So malaria is a very important public health factor, and as Mengo Hospital, we are taking stands against it through awareness. Awareness, even our patients we treat for malaria, we follow them up to tell them about prevention. So malaria can recur. So you can come, we treat you, then you get married again, which impacts you, your family, and everybody. Yes.
Looking at the 16 million malaria cases and over 16,000 deaths which are recorded, what are the main factors contributing to these preventable deaths? I think we can have a highlight about those.
So what is causing preventable deaths from malaria? First of all is we have not taken care of to understand how we get malaria. How much we talk about it, people know that in case you sleep without having a mosquito net over your bed, you're going to get malaria. People don't, when you're going to stay outdoors for a long time, please apply mosquito repellent. If you know that you're going to go to a bushy place, have long sleeves. So these things are not implemented. If we say stagnant water is a breeding place, can we have that stagnant water removed from our environment? It's not being implemented. People slash bushes around your environment. Some people stay very near to their farms. They have a maize farm, a rice farm, or a bush nearby. They're not taking care. No, this is a breeding place for mosquitoes, and it's going to cause us malaria. So the preventive mechanism are not being implemented, and also now that we have the issue of self-prescribing medicine, person gets malaria, they just get themselves some treatment. They prolong the malaria begins. The parasites keep multiplying, keep affecting organs. So they come with severe, complicated malaria. So that accounts for the deaths. Another issue is that malaria is a fast progressing disease itself. So as soon as you get symptoms, rush to hospital. But they have a delay. We have a delay. People, it was usually attributed to the traditions where the man is supposed to tell us to go to hospital, the financial burdens. There's a delay to seeking medical care. That accounts for death too, from a preventable cause. Yes, and other things, unless it's not well diagnosed, some people go to hospital in time, they don't get the right diagnosis, they think they are treating something else. Then by the time you're treating malaria, someone has passed on. We got that usually in COVID-19. Patients would go to a health facility, they have malaria, but the symptoms they're usually general, malaise, fever. So they are going to treat them for COVID, and they pass on for malaria. So that was another issue. However, now that we are in a stable population, as long as you come to a health facility, you're diagnosed with malaria, you're treated, you should have complete recovery. And that's as it goes very fast, it recovers very fast too, if managed very well.
I was kind of that part of the signs and symptoms. How can, I believe there's some individuals who are in the rural areas, I think, and maybe they couldn't be having this knowledge, maybe of how can they be able to know that I'm having malaria? What are the signs and the symptoms? Besides the fever, someone having headache, and so many other things. I think you need to break down for them and get to understand this better.
So the signs and symptoms of malaria are usually common signs.
They are common signs.
They are common signs. Somebody will say, I have joint pain. I have headache. I'm having a fever. Some people even get malaria without fever. Because malaria has stages. We have the cold stage. We have the hot stage and the sweating stage.
Now talk about the stages now. So this is another thing.
In the cold stage, here you have parasites that have entered your body, the Plasmodium, Malaria, all the different species of parasites that entered your body. Then they are going to go to the liver. They begin growing there. You're not having any symptoms there. It actually takes about 7 days for you to begin getting the bite.
Okay.
So you're there. You begin when they're in the red blood cells now from the liver. They begin rupturing the red blood cells. So they are growing and rupturing the red blood cells. You go into a cold stage. You begin feeling cold. So you find the person says, I want to cover myself.
Yeah, yes.
As soon as after like 60 minutes, they begin feeling hot. They begin throwing out everything.
Okay.
So person gets fever. And as the fever is climaxing, they begin sweating. And the sweat cools their temperature. So they will get cold again.
Okay.
So with that kind of symptoms, some people be like, am I okay? Sometimes by working class, they got the cold stage, they feel weak, they don't care. When they get hot, they get paracetamol. They begin interfering with the body.
Yes.
The body is trying to alarm you. So you get fever, you begin getting joint pains. You begin getting headache. And severe forms, you begin getting convulsions, especially in children and mothers. They begin convulsing, getting seizures. They begin having passing out Coca-Cola colored urine.
Yes.
That means you're having damage to the liver, to the kidneys. You begin passing out very dark urine. Some of them will get confusion.
Okay.
Others may begin prostrating. Somebody feels they go to a position, they get stuck there. They come out, some lose consciousness. And then it depends on the progression. The more you delay, it keeps the symptoms begin coming worse and worse. Yes.
Great. Maybe at this moment, allow us to get into a quick commercial break. We'll be coming back with Dr. Brian Ssemakula from Mengo Hospital as we are discussing about malaria being one of the most common disease in our country, Uganda, and the way forward to it. Yes. Stay tuned to the coffee break conversation.
Thank you.
This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission. This is Church of Uganda Family TV. Enriching lives. Regulated by the Uganda Communications Commission.
Yes, and welcome back from the quick commercial break with the statistics given unto us by the Ministry of Health, whereby over 16 million, malaria cases are recorded and over 16,000 deaths. These are received annually due to the issues of malaria, which is the concern. And to all the Ugandans, what does it call? What does it really intend? It's a wake-up call for us as a country to ensure that this is resolved as early as possible. But of course, we want to find out, looking at doctor with the 90% of the population at risk, because Uganda remains on the high, having one of the countries with a high burden of malaria. And we're looking at this is continuously happening, being the major threat to the country. And despite the years of intervention, what does this bring on to you as doctors in Mengo Hospital? To be that Uganda, for the past years, this is it's like a song which is happening over and over again. The interventions of trying to do this and this, but
It's not going away.
It's not going away.
So I'm not recent about the year, but under our parliament, they are even suggested to fumigate the whole of Uganda with DTT, which is a chemical trying to kill mosquitoes. In order to eradicate malaria. But this was studied in other places where it was used, like in the United States of America and other places, and has high risk of cancers. So you try to remove one cause of death to cause another cause of death, which is even more severe. So malaria stays with us as a cause of death. However, this malaria, just like you said, it's not there. So it has an advantage to us against the risks. Just that we know it causes deaths. It is the most common cause of death in Uganda. We are fighting it. We've said people are not taking the preventions very seriously. However, if you are going to fight malaria and go out with it, the public needs to be together. We need to make a consensus to prevent malaria very well from our sources, our different homes, moving to the structures, the government, to make sure that actually people don't die from malaria. And one of the things that we have done, or Ministry has done, is to present the malaria vaccine. So children aged 6 months, they are starting to be immunized with malaria vaccine. This vaccine doesn't prevent a person from getting malaria. However, it prevents the severe forms of malaria.
It just prevents.
It just prevents getting a severe form of malaria. So in case just like we are immunized against polio. So sometimes when you get polio, you don't even notice. Your body clears it before even anything happens. So even this malaria vaccine, when you get a mosquito bite, your body also has an immune system, which is just going to come up, begin fighting for you. So you won't need to be admitted for many days to go into ICU. In that way, you are trying to reduce the infant mortality from malaria. Just like you know that children and mothers are dying most from this disease. So that vaccination is important. And also for mothers, this is causing many maternal deaths. We have the prophylaxis. It's called intermittent prophylactic treatment for malaria, where we give them Fancida in pregnancy. And our mothers who are not attending antenatal care, we really urge you to come for antenatal care. In that care, you're going to receive this prophylaxis to prevent you from getting malaria when pregnant. That way, we are reducing this from malaria. And I think that is basically what we should do, except to prevent malaria at a personal level. Take up the malaria vaccine for children. And then stay responsible. In case you get malaria, have it treated to completion. Don't take a half dose and you go start feeling better. You're going to get malaria again.
I think you should clarify more about the treatment, how it's supposed to be done, because as you've said, a patient will come and he or she will be given the medication. Of course, you're going to find out someone will take it today. After 2 days, he or she is feeling better and says, I'm okay, I'm going to continue. And you're going to find out it again. I don't know what happens. It again comes back. How is it that?
So there are 3 terms. There's relapse, recrudescence, recurrence. So relapse is a person has been treated for malaria with complete resolution, but they get malaria again. Recrudescence is that a person is half treated with malaria, and then they are not fully cleared parasites. They feel better, then they come back with malaria. However, the other severe form is that some people, because malaria first goes to the liver, it has what we call hypnozoites. These are malaria parasites which hide and sleep in the liver. So for you treat, the person feels better, but they are there. So as you're done with your treatment, a week later, they wake up from the liver, they come back, person gets malaria again. So with all those stages and technicalities of malaria, treatment has been tailored to prevent all those from happening. One of the things that we are doing is that when a person comes to the hospital, they have the symptoms, fever, headache, sometimes vomiting, there are muscle aches. Every patient actually with that kind of presentation, we test them for malaria. After I tested for malaria, if it is positive, and we don't test with just, we call them MRDT, we just pick a sample blood, drop it there, they put some solution, then they say, okay, it's positive. You have malaria, that's called MRDT. But also we test it by using microscopy. We pick a blood sample, put on a slide, see it at the microscope, and know that this is malaria. You can even classify which parasite is causing. There are about 5 parasites causing malaria, but the most common in our region is falciparum. Okay. So you get to know this, and then you treat. Malaria is treated for 24 hours. Surprising.
24 hours.
24 hours.
Interesting.
When you come, we get the hour 0 when they give you the first dose of malaria treatment. That is the commonest drug we are using is artesunate.
Yes.
So you receive IV artesunate. We give you a 0, 12, and 24. If you take the right dose, very well, after 24 hours, you have to take blood again and check have we cleared all the parasites. So in some places that's not done. However, in Mengo, persons come with malaria, you have to test them again. Have we cleared the parasites? If you haven't cleared, it means you have to continue treatment. And even if it has cleared, we don't just say, okay, now it's done, please go. No, we look out for the complications of malaria, and they also manage it. And even if you have no complications, we are going to discharge you on prophylaxis to continue treating you for 3 months.
Yes.
We are going to give you tablets you take once a day for 3 days. And if it's a child, we have what we call the smart discharge. We keep treating you for malaria for 3 months.
3 months.
So every month you get malaria treatment. After the treatment is done, malaria treatment for 3 months. We are preventing another recurrence of malaria. So in that setting, we assure this person, if you have malaria today, they shouldn't come back. It should be cleared. And that's what we are doing. So treatment, the other things that the other drugs can treat malaria: quinine, chloroquine, piperacquine. You have other drugs. However,
look at the coetam. How is that also?
So coetam is lumefantrine.
Yes.
Coetam has been with us. It's a very nice drug. It's an artemether combination. It is a very good drug. However, because of the misuse, which I said, people get symptoms. Sometimes they really have malaria. They go, the pharmacy, buy themselves coatam. They take the drug. They are going to take a few doses. They feel better. They leave it there. They go to their business. These parts are not fully cleared. They are going to learn how to avoid death from this poison, which is the coatam you're taking. In that way, in case you get malaria again and use coatam, it will not work.
Okay.
So because of that, you're going to get severe malaria. You're going to get malaria, you get the symptoms, you go to get the coatam, you take it, you're not getting better, you take it, you're not getting better. You're wasting time. So you get severe malaria, which is very deadly. So coatam, however much being a good drug for treatment malaria, we're no longer using it because of the resistance levels. Almost everybody is resistant to coatam.
Yes, true.
And we are advocating that even our good drugs which are working right now, we don't want to get resistance. So we ask the public, please don't prescribe yourself treatment. In case you fall sick, kindly seek for care. And even the clinics, we advocate for our colleagues who are doing our clinic practice. Let us diagnose these people very, very correctly. Find someone that has no malaria, but they're given anti-malaria treatment. So it be in their circulation, they get malaria, these parasites find this drug, they begin fighting them, they get resistant too. So the misuse of medicine is very, is happening in Uganda because of our policies and what. However, the public should be informed. That's what we're doing right now, to be sure in case a child gets sick or you fall sick, kindly seek professional medical care. If you have malaria, be treated for the right time. Some people there is in an emergency state. I'm going away. I'm doing this. Let us treat you. Be fine and go. I'll give me one dose. I'll get another dose elsewhere. They feel better after the first dose. They stop. So there's a risk for our drugs which are good also getting resistant. Partly because of the patients, because of us, the professionals who are not doing it the right way. So we need to work together to treat malaria very well. In Uganda, according to the Uganda guidelines, we prefer to treat malaria with artesunate, IV, artesunate. We might have other treatments. We are standard. Good standard right now is IV, artesunate. Quinine is being used, but it has a high mortality. If you use quinine and you don't use it correctly, you can even kill the patient. If malaria kills the patient. So it needs to be used very correctly. However, why do you go for quinine when the artesunate is very good, easy, friendly, fast? So we advocate for use of artesunate IV and the right way. If you go to a clinic and they say you have malaria, they don't take your weight because it is given per weight, per kilogram weight. They just tell you, we put a cannula, we begin giving you treatment.
Yes.
You have to be worried. Either they're going to give you a very small dose or a very big dose. But usually they are going to give you a small dose, which is not going to clear your malaria. So you're going to leave the clinic or the area you've been treated, then you go to another place when you have the similar symptoms a few weeks later. So that gives the recurrence. So whenever I go to a facility, they tell you have malaria, remember in yourself, they take my weight, or they ask you, do you know your weight? So they're going to give it to you per weight. Thank you.
Thank you so much. Looking at the part of affordability of these medications you're talking about, are they favorable to our Ugandans, to all those people who are maybe having a low income, maybe this and this? And what are the challenges have you encountered as a doctor in Mengo Hospital with these patients?
So, malaria, malaria treatment is affordable. It's not very expensive. I told you, said you treat it for 24 hours. So, ideally, if you come in time, we don't even admit you. We tell you if you're coming from near, get your dose, come back. Get your dose, come back. Get your dose, cleared. We test again. You're free. We give you a discharge plan. However, like I told you, people are not going to come to hospital in time. Some going to feel symptoms. They go to ask their colleague, "I'm feeling weak. And you first get some cotton." They take some cotton. Doesn't work. They ask someone else. They take herbal medicine. They do what? By the time they come to us, they have severe malaria, complicated malaria. So you're going to find that the duration of stay is becoming longer, the bills are becoming larger. However, if you came in time, malaria treatment is very affordable. Come in time, you're diagnosed. Diagnosis is very cheap. It doesn't go beyond 10,000 to diagnose you for malaria. Even in Mengo Hospital. It's very cheap. You know, okay, I have malaria. Treatment is very affordable. But because people come late, someone comes malaria and they are even admitted to ICU. Because the liver is failing, the kidney is failing, the heart is failing because of malaria. They are transfused. So the earlier you come to hospital, the cheaper it is to treat you for any disease, especially malaria. Because that's a bit of even causing death. Because it's causing death. So if you come earlier, we treat you in time, cleared, go back to your business.
Looking at the part of sensitizing the public about this all information, how far have you gone through this as Mengo Hospital, most especially to all those people who aren't in central Kampala and also other far places to get to know about this key information when it comes to malaria?
Thank you very much. And even what you're doing, I want to thank all our partners, like even Family TV, like what you're doing here is sensitizing people. Some people watch this TV not even only in this region, outside those regions. They get to see this, they get to get this information. Also, when patients come to us, we have what we call conference. So we give a patient a conference time. We teach you about your disease. So a person comes to us, we teach them that, hey, you have malaria. What causes this and this? How you prevent it, this and this. So that they don't come back again. Wherever they go, they have the knowledge now. They, hey, you have this symptom. They told them to me in Mengo, you may have malaria, you go to hospital. So that's don't treat yourself malaria. So you go to. So we give knowledge per patient. You tell them to be our ambassadors, to teach to preach the gospel. So the person you get, you teach them. Person you get, you teach them. Also, we make flyers, distribute them around our vicinity. When you come, we give you a flyer. Tells about malaria, how to prevent it, other diseases. We have another departments, NCD department, about other things. So we give you different information to let you be the ambassadors to teach other people around you. That's what we are doing as Mengo Hospital. Though a lot needs to be done. We think it's not enough. A lot needs to be done to teach people about malaria. Because malaria is here with us. It has been with us. It's going to be with us. Unless we take a clear stand to know that malaria should not kill me, not kill my family member. So we have to do this the right way. We are going to be free from malaria if we agree. So even you have our materials in other languages, Uganda, Luo, Lango. So when you speak Swahili, we have a good community of Somalis. We have close to all those languages. That when you come, you don't speak only English to you. I'm not fluent in speaking Somali, but I'll give you a flyer which has your language, and to teach you everything. If you come and you don't speak English, I'll give you a flyer with Luganda. I speak Luganda, I'll speak to you in Luganda. If you speak maybe another language, which Arabic, we have those information materials there. And also have screens in our hospital which teach people about it. So I think we are not yet to the epitome of prevention, of informing the people. However, we are trying something, and I think everybody should adopt it. When you know, inform. Yeah, I think that's what we should do.
One question maybe I would love to understand, maybe also the viewers who are watching us. We're looking at prevention, medications we have just to prevent this and this. Then we think of Uganda maybe trying to get the final medication maybe that will treat malaria once and for all. It is a process that needs to be looked into, and having to, are there any other way how we can partner with other maybe organizations or whatever it could be to help us attain to this, so that in the coming years we can also be grateful enough, like how HIV/AIDS was being silenced slowly by slowly, because I believe it is a process to reach to that stage. So as Dr. Brian, give us hopes that
malaria can be cleared in Uganda. I think in the first section of this, we talked about the proposal to fumigate the whole of Uganda, that we kill all malaria-causing vectors, the mosquitoes. It was denied. It was stopped, which was a good thing to stop it, though a bad thing to stop it too. The risk is that it has the risk of causing many cancers.
Okay.
So if you're going to fumigate, people are going to breathe in. It's going to go in the food system. It's going to go in the water system. It's going to cause fish death. It's going to cause birds death, which you want to kill. So it is you're trying to kill a rat with a rocket.
Okay.
The other way of we have tried to do is to vaccinate. That way we are reducing the incidence, and we're also reducing the mortality and the morbidity. Like the person getting very severe malaria is going to become rare. The coming children, like children born after who are received vaccination, they won't have to get severe malaria causing them admission. They are vaccinated, the immunity is there. When they get malaria, they can easily recover. Some can even recover without treatment. Others recover with minimal treatment. So that is in process. Also, with sensitization, you just reduce people getting severe malaria. However, saying that we are going to come to a place where it's malaria zero, I think it is not what you're going to push for. We can come to zero deaths if we put in place the prevention, timely treatment. But to say we are going to get zero case of malaria anywhere, I think we are not going to reach there very soon. There's a place called Ethiopia. For them, they have gone out from being a malaria endemic place, from being a malaria endemic region or country, because of vaccination. So people are there. Nobody is there and they're having parasites talking in their body at every time. No. So we can achieve that status. We are not malaria endemic. However, we may have malaria with us. They're not dying from malaria. Like just like we had HIV killing people, clearing people. Though HIV still lives with us, but it's not killing people the way it used to. Clear them because they are put in place the prevention, but taking that treatment in time very well, so they live longer. Even malaria, the good malaria is when you treat, you get okay. So you clear the parasites, you're fine. So that you're going to keep on treatment. No. So if you get malaria, treat it in time, get cleared, get well, then prevent it. No, I don't want to have malaria again. I've taken over 7 years suffering malaria. 7 years. Yet I stay in this region, I stay here, but I know what to do.
How are they supposed to manage this?
So managing malaria is supposed to be done at the hospital. Managing getting these diseases, prevention. So the best thing, if a person has malaria at home, especially children, when they get malaria at home, sometimes mothers are working, the parents are working, so you're going to find the child you don't get the clear flow of the symptoms, the cold, the hot, the sweating, but you get this child is weak, maybe they are vomiting, they have a very high temperature. You're allowed to tap it, sponge them, shower them with not very cold water, normal temperature water, If you come to the show, I could tell you tepid sponge, means you get hot water and cold water, mix it, and begin sponging the child. Lower the temperatures, you're preventing risks of convulsions. Children get what they call febrile convulsions. And the person who convulses, they get brain damage.
Yes.
So if you manage that in time, they won't get other severe symptoms. However, it happens. So in your home, you notice the child is not well. If they are very hot, try to lower the temperature. Shower them. After showering them, you notice them, they are vomiting, make sure they are okay, clean, carry them to hospital. Let them be treated, then bring them back home. When they are treated, continue their treatment plan, put in place the prevention. The risk is when one person has malaria in the family, other people are 90% risk of getting malaria. Mosquito will bite them, pick the parasites, take the other person. So when you have a patient with malaria, you don't have to waste time. Have them treated. You can even have other members tested. And then you can even put on prophylaxis, then not to get malaria in the near future. So I think with that, management at home is don't allow the child to convulse from having rate of temperatures. Shower them. And don't keep them after they are showered, now they are okay. No, bring them to hospital. Let them be treated. Yes.
Thank you so much, Dr. Brian Ssemakula, for that wonderful conversation. Yes, we have come to the end of this coffee break conversation, and let's have 2 words to the public, and we close up.
So I'm going to say very few things. Malaria, however much it is a cause of death, it influenced how we are living today.
Yes.
You know that Uganda wasn't colonized. We still colonized by the British, but they weren't colonized other countries. It was just a protectorate. Malaria protected us from full-blown colonization. Whenever British went, they would destroy the kingdoms, destroy the kings, take over power, and then establish a structure. However, because of malaria, they wouldn't survive here. It would kill them faster. That's why they called Africa the white man's grave. So in that way, they had to collaborate with our kings to make sure they rule us. So in that way, our structures were maintained in some way. So that's a positive for malaria. It helped us in that days. However, it's still causing death to our people. Our people need to seek care in time. You need to go to hospital in time. You need to prevent death, which is preventable. Whenever a person has malaria and they die from malaria, you have lost a father, you've lost a child, you've lost a mother, you've lost a leader, you've lost a doctor, you've lost an engineer. So we should prevent deaths from malaria. Take your medication. When you have symptoms, go to hospital. If you're pregnant as a mother, go to antenatal care, receive the prophylaxis against getting malaria. If you have any person in your community and they have symptoms, advise them, tell them, please go to hospital. And that way I think we shall be able to fight malaria and end malaria by 2025. That's the plan by the WHO and Uganda Ministry of Health. By 2024, we should reduce malaria death by 50%. Which we are going to wait for the report 2025, how much we did to that. However, I think we are doing a step towards there. Northern Uganda region and Lango region are still the leading, spots for malaria deaths. Which I think with this knowledge, people should put in place the recommendation. The policymakers should be more proactive against malaria in those regions and even other regions to make sure people live productive lives, people live peaceful lives, and people can grow in that way. Thank you very much.
Thank you so much, Doctor, once again. And thank you so much, viewers, for being part of this coffee break conversation as we focus on the health part, that is the alarming matter, that is the malaria, which has been a main concern to the families, the public of Uganda, most especially especially the mothers and the young children. Yes, but of course, the knowledge is available. What we are only doing is to sensitize the public to ensure that you get to know what you are supposed to do, so that 2026 ends up with a good report from the Ministry of Health that malaria has reduced. Otherwise, allow us to wish you a blessed Tuesday. My name is Ritah Nandera. Shalom. Bye-bye.
Bye.
This is Church of Uganda.